All right, so number 5, what considerations do nurses need to be aware of when teaching female, male, and non-binary clients? So with this question, I thought it was interesting with the YouTube video, Gender and Learning. Lise Elliott brought up a great point in regards to gender sexist, stating that there are no test score gaps between the sexes. So what we need to implement is differentiated instruction, which is basically a personalized approach to care for each individual for nursing is what I kind of grasped from that. So, and basically similar to the discussion mentioned in our first recording, a good teacher will try to teach every child in the classroom. And this was mentioned in our last discussion with a subset of teachers where like Natalie, my daughter, her teacher was less tolerant of the boys' activity levels and being like rambunctious in the classroom. Another point I brought up was as far as teaching any of these clients, I feel as though in our role as RPNs, we need to be aware of the health inequities and social determinants. And Leonard Sachs mentioned in the video that 85% of students with household income earning, how 85% of students with household income earned more than 100K score proficient in literacy and writing skills compared to 71% of students from lower income households that are less than 100K. So like we need to basically be aware of the social determinants of our clients and just making sure we understand where they're coming from and their education, their level, the resources that we give them and how they can understand them.
Awesome. I think that the point that you made about, oh, I totally forgot what I was going to say. Anyway, I think that it's important to consider trauma. Oh, it was when you talked about patient-centered care, I think that was a really good point. And, you know, regardless if someone is female or male or non-binary, that it always has to be individualized and patient-centered. I think that was an important point that you made. The other things I was thinking of, like being careful that you're not stereotyping, being aware of your own biases and judgments, and that can affect how you give care. And I think as well was asking them how they want to be addressed. Especially maybe for a patient that's non-binary, like asking them how they want to be addressed so you don't say the wrong thing or call them, you know, something that might trigger them or
Yeah, so I definitely agree with you, Carrie. I actually kind of went the same avenue as you. So what I found was considerations that nurses should be aware of are being open-minded. So when working with non-binary clients, nurses need to be sensitive of their language and have an open discussion with clients to see, like you said, what they like to be identified as. Is it a he? Is it a she? I also read that some individuals don't even like to be identified as a gender. I think they called it a gender queer. So studies have shown that 48% of the transgender community has avoided or delayed health visits due to the many barriers they face, such as stigma and stereotypes. It is significant for nurses to be aware of higher risks involved with the transgender community and perform proper assessments when they do come in. These high risks include victims of violence, sexual assault, increased mental health incidents such as suicide risk, anxiety, depression, lower availability of social supports.
Yeah, I agree with all of you guys. I think it's important to be aware of what our clients would like to be identified as. Like you said, Holly, to be open-minded and be sensitive to their identity. Just like we should be culturally aware and sensitive, I think we should just be more aware of what our clients are facing and what they're wanting to be identified as. We should educate ourselves on like their gender identity and what their roles are. Okay, any other responses? Okay, I'll go on to question number 6. Considering your response to question number 3, what situations would be deemed acceptable or not acceptable to consider a patient's, client's gender in implementing nursing decisions and practice? So for me, how I interpreted this was that I don't think it's acceptable to dismiss a complaints of any unexplained pain or other issues because of their gender, as it could be potentially delaying a true diagnosis. In reading this question, I felt that it's important to always consider the patient and client's autonomy. They should not have to expect to receive a lower standard of care because of their gender. Considering my response to question 3, I found it interesting to read that women have a 50% higher chance of receiving an incorrect initial diagnosis after receiving or after having a heart attack. Women are approximately 30% more likely than men to have symptoms of stroke misdiagnosed and be sent home from the ER. And once they are diagnosed, women are less likely to receive appropriate treatment or medication than men.
Great. Yeah, so I kind of went the same avenue as you, Monica. Just considering my response to question 3, I just talked about how genders are different physically and biologically, and just in terms of how women are more likely to suffer from heart attacks at older ages. Their symptoms and signs are a bit different, just what to look for in males and females. And then just how women actually, their traces for their ECGs actually are non-detectable in ECGs when it comes to heart attacks. So their treatment interventions might look a little different than men. So I think that might be a consideration.
I was thinking about how there are places where it's really appropriate to consider gender. I was thinking of the comfort plan, and within the comfort plan, it asks people, would you prefer a male or a female worker, and asks questions as like, you're okay with touch during a crisis or not? So I think that we have to definitely take into consideration people's preferences. They have to understand that like there might not always be the option to have a man or a woman, but giving them that choice is really important. Like for instance, there was a patient in special care one south, and he was getting injections every day, but he did not like women to give him the injection. So I think that it's important to that person's care that he gets to have some say in that, because there's probably a very good reason why he's asking that. And I think that for things that are not acceptable in considering gender is, again, just that idea of like biases or making assumptions about an intervention being successful based on somebody's gender. The intervention has to be appropriate to the individual.
I agree. So I was looking at my questions and answers. I thought firstly about when a client is admitted to the hospital or the tertiary care facility and a non-binary client choosing on the form only male or female. So the beds and rooms are not always like appropriate for them or the transgender as well. So this can often be related to how we address them. And you mentioned that, Carrie, in question 3, and how we address our clients. And so I noticed in our clinical, the safety plan and comfort plan, there's a spot to fill out what I prefer to be called, which I thought was great, but I also noticed it blank quite a few times as well. And I thought that making sure as a nurse that we sit down and discuss with the client through therapeutic engagement on gender-specific identity, whether he or she is non-binary, transgender, or the LGBTQ, as often this is stress that the client is probably showing and doesn't want to relate it and doesn't want to probably open up about it. And then also I think nurses, they're feared on addressing this. I've heard in some research articles, I don't think they're educated enough. And I think people just disregard talking about it. And I just, by asking questions to your leader or peers, I think the client's care can be more supportive, dismantling stereotypes and biases that they face.
Yeah, there's definitely a huge need for more education in that area as well. And I think not just for nurses and staff, but also for patients as well.
I agree.